Total hip replacement traditionally is done by the posterior approach. In this approach, the patient is lying lateral or bent or turned to one side, and we give an incision posteriorly on the hip. After giving this incision, we cut the abductor muscles and reach the capsule, after which we expose the hip joint, we remove the old hip joint and we put in the new implants. There are three basic problems with posterior approach. The first problem is that because the patient is lying on his side, we cannot use intraoperative radiographs or intraoperative x-rays or what we call C-arms. Because of this, we are not very sure if the positioning of our implant is perfect. Although doctors and orthopedicians have made ways to ensure that the implant positioning is correct, but still it is not as exact or as perfect as looking at in an x-ray. The second big problem. During posterior approach, we cut or we incise your abductor muscles. Now, cutting the muscles is a big problem because muscles take a lot of time to heal. Now, during this time of healing, the patient has to stick to some precautions, primarily keeping both the legs apart or keeping a pillow in between the legs. Because this is done so that to avoid a risk of dislocation. Third big problem with posterior hip approach is that leg length cannot be measured precisely or exactly. Leg length referred to the length of both the legs. When we do a hip replacement, we have the freedom to either increase the leg length a little or to decrease the leg length a little or to make it exactly equal. During the patient lying on the side, although we measure the leg length intraoperatively, but it is usually not perfect and we are erring either plus 2 millimeters or minus 2 millimeters. Now, solution to all these three problems is a new approach, new to the Indian world, but done very often in the Western world, called the direct anterior approach to the hip. Direct anterior approach solves all the three problems. So in this approach, the patient is lying down supine meaning like you lie down normally on your back. We give an incision in the front of the hip and we go in between the muscles rather than cutting any muscle. This leads to earlier recovery, no keeping pillow in between the legs, and less pain. The second good part is that because you're lying on your back, we can get an x-ray. We can get this x-ray and be sure that the positioning of our implant is almost perfect. The third great thing is that because again you're lying on your back, we can measure the leg lengths of both the legs intraoperatively and ensure that we reach a perfect leg length. Although direct anterior approach is being done extensively in the Western world, the proponents of direct anterior approach in India are less. This is primarily because our training is based on posterior approach. All of us are trained primarily in posterior approach, and shifting to the anterior approach is a little difficult. Also, anterior approach has a steep learning curve, so the first 30 to 40 cases of almost all surgeons have some complications and are not perfect. If you are scheduled for a hip replacement, you should take an informed decision if you want to get a direct anterior approach or a posterior approach. You should also ensure that your surgeon is well trained in doing a direct anterior approach and that you would not end up in a complication.